This is Dr. Ashok Punjabi, Director, Krishna Cardiac Care Center, Dadar, Mumbai, and consultant cardiologist to Lilavati and Global Hospital, Mumbai. I am here to present to you day 2 updates for ACC.22. Well, patiromer for the management of hyperkalemia in subjects receiving renin-angiotensin-aldosterone system inhibitors for heart failure with reduced ejection fraction. These are the results from the Diamond trial. Well, the primary endpoints were adjusted mean change in the serum potassium level to the end of the study, which was in June 2021. And the secondary endpoints were time to the first event of hyperkalemia, which was defined as more than 5.5 milliequivalents per liter. Time to reduction of MR antagonist dose below the target 50 milligram of spironolactone or eplerenone. Investor-reported adverse events of hyperkalemia, win ratio for morbidity and mortality, adjusted hyperkalemia-related outcomes on CV death, CV hospitalization, total hyperkalemia events more than 6.5 milliequivalents, total hyperkalemia events more than 6 to 6.5 milliequivalents, and total hyperkalemia events of more than 5 milliequivalents. Well, the results of the primary and secondary endpoints were presented. Between the group, there was a difference. Patients had a lower number of patients on patiromer had hyperkalemia of more than 5.5 milliequivalents per liter, and patiromer treatment maintained lower potassium levels for several weeks while on therapy, and the effect continues as compared to patients on placebo. So the key takeaway points from this study was that patiromer was associated with lower incidence of hyperkalemia events and greater proportion of patients being maintained on MR antagonists at the target doses. There was no need to reduce the MR antagonist doses. Patiromer led to a 35% relative risk reduction in the total number of hyperkalemia events. The win ratio for morbidity adjusted hyperkalemia events and the overall RAS inhibitors U score was both significantly higher with patiromer treatment. One study called a cluster randomized pragmatic trial aimed at improving use of guideline-directed medical therapy in outpatient treatment with heart failure patients, called the Prompt Heart Failure Study. Well, this study was for messaging to providers about patients' outpatient treatment of heart failure, designed to test the hypothesis that timely and targeted altering of recommendation about the medical treatment of patients with heart failure with reduced ejection fraction tailored to the patient would lead to a higher rate of guideline-directed medical therapy prescription compared to the usual care. The primary clinical endpoints was the additional patient class or additional number of patients who achieved guideline-directed medical class as aimed at. Also, the secondary clinical point was increase in the guideline-directed medical class and increase in the dose of the therapy being prescribed, and more number of patients achieved the optimal dose for ACE inhibitors or ARBs or ARNI, or whether it was MR antagonists or it was beta blockers and SGLT2 inhibitors. The more number of patients achieved the target dose in this trial. So the takeaway message was a personalized alert triggered via the electronic media during the office visit led to a significant higher number of patients with heart failure with reduced ejection fraction on appropriate guideline-directed medical therapy. This low-cost tool of electronic alert can be rapidly embedded into the electronic health records at integrated healthcare systems and led to a widespread improvement in the care of patients with heart failure. SuperWin, a randomized parallel assignment active control efficacy trial. Now, what were the outcomes of the SuperWin trial? The primary endpoint was DASH score, measure of the DASH diet adherence. The hypothesis which was tested were two tests for DASH score change from baseline to 3 months, strategy 1 and 2 versus control, and strategy 2 impact of online shopping and nutrition application. The strategy 1 was impact of data guided in-store teaching, and these were studied as to what impact they have on patient management. SuperWin provided evidence for interventional in modern supermarkets and store-based clinics, online shopping and nutritional applications, automatically, electronically collected purchasing data. SuperWin was made possible by first of its kind research collaboration. Now, the next study was the past, present, and future addressing the global burden of hypertension and cardiovascular disease. Hypertension, as we all know, is a poorly detected, treated, and controlled worldwide. Improving potassium intake, potassium-rich salts, fruits, vegetables reduces the blood pressure, cardiovascular disease, and cerebrovascular disease and mortality. Combination of BP lowering drugs plus statins plus aspirins safely reduces cardiovascular disease by 50%. BP detection, treatment with drugs and statin, plus the risk factor controlled in the community using the national health workers and lay supporters can lead to a large reduction in cardiovascular disease risk by 50%. Such a low-cost community-wide strategy can provide over 10 million CV dates events every year globally and is applicable to all socio-economical settings. Thank you. These are the updates for the day 2. Please await for the updates tomorrow for the day 3 of the ACC 22. Thank you.